જાગ્યા ત્યારથી સવાર. Awake, arise and go. Hello, my dear family and friends. I am here. Roshni, hardly 30 years, a computer programmer. Around about an year before, she had a nagging neck pain. And she could not work in the kitchen. She could not work on the computer. But that has gone with the wind. No, gone with the therapy. Now we will be talking about the troubleshooter trapezitis. That was her problem.
Hello, my name is Roshni Patel and I'm from Florida. During COVID time, when we were forced to work from home and I was working long hours on my computer from various different locations, like from the couch, from the dining room table, or just from my office as well, I had developed some pain in my neck and it just kept getting worse and worse and worse from just hunching over and working like this. And because of that pain that was right here, I started feeling it kind of go down my left arm as well. And then I felt a lot of tinglingness. I felt stiffness. Also, I felt like I was losing movement and the strength within my arm as well. Like I wasn't able to grab and hold on to things very easily. And at one point, the pain became really bad. So we rushed to the urgent care. However, unfortunately, they were not able to help me with anything. And I came home still in that same pain and without any medication. At that time, my husband suggested that we reach out to Dr.Dilip Patel, who is also family to us too. But, he's been a physical therapist and has his PhD, so we knew he'd be the right person to reach out to. And he suggested 3 things to me. One was to apply biofreeze in the areas where I could feel the pain. So I applied it here in between my shoulder and my neck, as well as right over my forearm. The second thing he suggested was to do these isometric neck exercises. So I would do those a couple times a day. And then the third thing that he suggested, which is a lifesaver for me still today, is this neck pillow, which you put around your neck. You inflate it to the maximum point that you can bear, like it gives a good stretch. And doing all this, literally within 10 days or 15 days, my pain was gone. Like there was no pain at all. My stiffness, the tinglingness, the strength that I had lost in my arm, it was back. My movement was back to normal. So I would say just doing those 3 things really helped, and it still helps today. I haven't experienced anything crazy like that since then, but if I do have some crazy days where I'm on the computer for an entire day, I do like to just do a quick stretch with the neck pillow. So I want to say, because of what Dr. Dilip has suggested to me, my pain is completely gone. So I'm very thankful for his suggestion and his help. Thank you.
My dear friends, my videos are for informations only. Please consult your medical or physical therapy doctor. Thank you. What is trapezitis? It's a pain, tenderness, tightness of the trapezius muscle, and inability to work in the house, kitchen, and at the office. Origin of trapezius muscle, base of the occiput and spinous processes from C7 to T12 vertebrae. Insertion, spine of scapula, acromion process, and clavicle. Nerve supply, 11th cranial nerve or accessory nerve, and blood supply, transverse cervical artery, dorsal scapular artery, posterior intercostal artery. Trapezius muscle action. It is a postural muscle. It stabilizes and moves scapula. It helps in neck, arm, spine movements. Now, causes of trapezitis: computer and office workers with poor posture, one arm repetitive work, stress of work completion, long hour of working, reading, driving, TV seeing with bad posture. Patience problem: nagging pain day and night, stiff neck and shoulder movement, tingling sensation in arm, cannot work in office and in kitchen, stress of work completion, long driving, poor posture at the work and repetitive work by one hand. Treatment: continue medical and PT treatment. Number 1, ice or biofreeze. Biofreeze is convenient to carry anywhere, everywhere. Rest with the soft collar or inflatable collar as shown below. And special breathing exercises. Isometric neck muscle exercises to be continued for many days. Wall pushing exercise. Gentle free active movement of neck and trunk. Resistive work with 2 dumbbells or water bottle. Here also there is a simple solution. Postural correction belt. Stretching of the trapezius I do not recommend. Friends, special breathing with benefits. We have to breathe in through the nose and inflate our lungs and chest. Hold there for 5 counts. Then breathe out through the mouth and pursing of the lip in our physiotherapy language, or like a whistle. And you have to breathe out through the mouth for a longer time. I will show it. Benefits: it will reduce the tension and ease out your body and mind. There will be better gaseous exchange, so more oxygen to the tissue which needs repair. And since the alveoli remain open because of the pursing and backward force of the air, maximum air comes out, minimum residual air, maximum room for the fresh new air. Isometric neck muscle exercises. You have to take your head forward, hand backward. Both forces are same, so there is no movement, but there is a strong contraction of the muscles around the neck. And after the strong contraction, there will be greater amount of relaxation of the muscle, spasmodic muscle. The blood will flow there more, and with the reduction of spasm, you will be able to move your neck freely, gently, but don't go beyond the pain range. And then second one is you try to push a wall this way. Push the wall and hold there for few seconds. That will also strengthen the muscles isometrically. Resistive work of trapezius muscle along with all trunk extensors, and then hold. And down. Ergonomics. Ergo means work. Study and advise for people's efficiency at work regarding performance, safety, comfort, aesthetics, correct posture, and work style. These are all you have to avoid it. Most important rule: take a break every hour for 5 minutes and reverse slouch posture. In our day-to-day life, we have a forward bending posture that we cannot avoid, but we can do this. Hello, health and happiness, simple solutions. Dr. Dilip Patel, PhD in Physical and Rehab Therapy, a family friend for your family and friends. Thank you.